Okay, so I'm in the supply cabinet in the front clinic, and as you walk in, this should look pretty familiar. We come over here. This is a portable AED. There is another one in the clinic across from cubicle 20, I believe that's 24. Over here we have a few things. We have our first aid kit, which is similar to the one we have in the back clinic. Same items: gauze, cotton, cold packs, ammonia. We have surgical tape, gloves, and bandages. Underneath that, we have our kit, similar to the one we have in the back clinic. We have our glucometer in here so we can check sugar levels. We have probe covers and probes for the thermometer. The albuterol is on the counter here. We have the glucose meter pouches as well, and the lancets with the adapters. Inside the medical emergency kit with medication, you'll notice the same thing as the one in the back. Everything is labeled. We have epinephrine, diphasmine, epinephrine for the injections, the ammonia inhalers, the epi 1 dose for the anaphylactic, the nitroglycerin here, the glucose gel, the nasal spray for the Naxalon. We have another inhaler over here. Same thing, the little packet with all the information about the kit, and all this is monitored by Yvette. Over here you have your perio tape retrievers. This is for your broken instrument. We have a chemical spill kit right here, as well as our protein bars for patients that are hypoglycemic. Inside the refrigerator, we do have a couple things here. We have orange juice, some Coca-Colas, and that's here for patient use only. And the last item we have here is our oxygen tank. And these are the items you will find in the supply cabinet here in the front clinic. So that's what we have here. Alright, so we're in the back clinic, and here is the oxygen tank. We are in cubicle 17, as you guys can see. So you come back in here on this side counter. You have your oxygen tank. There is a label, and right in here you have your first aid kit. You'll find all your bandages and items in there. Cold compress, gloves, iPads, scissors, surgical tape. And over here we have some more band-aids, the Bear aspirin, regular aspirin, your inhaler, Pro X, more band-aids, some inhalant aerosols, a cold compress, our hygiene medical kit, there is a book in here that gives you all the instructions of what is in the box, as well as how we replenish everything, as well as the MSDs for each of the medications here. And then on here you see everything is labeled as far as what's here, and it gets replaced. This is our it's like your EpiPen. There is a tester or trainer one, which is right here, and then you have your children's and your adult epinephrine, ammonia, and then here you have your glucose gel, the nasal spray, another inhaler, some tea bags, as well as your CPR mask, some aspirin, and then nitroglycerin spray that goes sublingually. And that's all in this emergency kit here. And you find that in the first drawer over here. Also, you have your perio retrievers here. You have your chemical spill kit. It's right in here. This also informs you the cubicle in which we have our emergency kit, which is adjacent to room 16. And back here, you would have found it, but it's no longer in there because the chemical kit has now moved to this side here, as stated.